let's talk about spine fusion. For a lot of people, just hearing those two words brings up a ton of fear and anxiety. But what if the whole story we've been told about it being a last resort is just, well, outdated? Today, we're going to reframe that entire conversation and shift our thinking from fusion as a failure to fusion as a foundation for motion. Let's dive in.
You know, this feeling is just so common. A patient shared this, and it really gets right to the heart of the problem. When a doctor tells you that you might need a fusion, it can feel like a verdict, like you failed at physical therapy, or your body just gave up on you. But what if we're looking at this all wrong?
Look, all this fear and skepticism around fusion, it doesn't come from nowhere. It's rooted in a very real history. The procedure has a bit of an old reputation, and to really understand where we are today, we have to be honest about where this all started.
In this right here, this is why people were scared. Decades ago, fusion was a whole different beast. We're talking huge 4 to 6 inch incisions. We're talking about stripping muscle away from the bone, 3 to 5 days recovering in the hospital, and on top of that, doctors weren't as precise about who was a good candidate. So yeah, it's no surprise the outcomes were mixed. That history created the stigma we still see today.
And this quote from neurosurgeon Dr. Kamal Woods just hits the nail on the head. It's acknowledging that yes, the bad reputation was earned, but, and this is the important part, that is not where we are anymore, not even close. The technology, the techniques, the whole philosophy has been transformed.
Okay, so what's the biggest misconception about fusion? It's what the procedure's actually for. We tend to think of it as a surgery for pain, but its real job is much more specific. It's a precise mechanical solution for a very specific mechanical problem: instability.
So let's get super clear on what we're actually talking about. A fusion permanently connects 2 or more of your vertebrae to stop abnormal, unhealthy movement at one specific level. It's not about locking up your entire spine. It's about fixing a single point of weakness that's causing a whole cascade of other issues.
This is such a brilliant analogy from Dr. Woods. I mean, think about it. If there's a loose bolt on a bridge making the whole thing shake, you don't tear down the bridge, right? No, you just tighten that one loose bolt. That's exactly what a fusion does. It secures that one unstable part so the rest of your spine, the whole structure, can finally move the way it's supposed to, naturally.
And this makes it crystal clear. Fusion is a super targeted tool for a structural problem, like when one vertebra actually slips forward over another one. That's called spondylolisthesis. It is not a cure-all for general achy back pain or a pulled muscle. You have to match the solution to the problem. If the problem is mechanical, the solution has to be mechanical.
So, how did we get from that old, frankly, kind of scary reality to this new one? Well, this is where the story gets really cool. The difference between fusion then and fusion now isn't just some small improvement. It's a giant leap forward, all thanks to technology that has completely changed the game for patients.
All right, first, I want you to look at this number, 4 to 6 inches. That was the standard for a traditional fusion. That's a big incision. A lot of disruption to the tissue, a big scar, and a really tough recovery. Okay, got that number in your head?
Now look at this, 1 to 2 inches. That's it. That is the reality of modern surgery. We are talking about an incision that's a fraction of the size, and that, right there, changes absolutely everything about how you recover.
And the changes go so much deeper than just the incision. Instead of that harsh muscle stripping, surgeons can now just gently separate the muscle fibers. Instead of being in the hospital for days, patients are often going home the very same day. And maybe the most incredible part, we've gone from surgeons placing screws by hand to using robotic assistance for millimeter-perfect precision. The whole thing is shifted from a massive operation to a targeted, often outpatient procedure.
But, you know, all the amazing technology in the world doesn't mean a thing if the human element isn't there. The best surgeons understand that the decision-making process is just as critical as the surgery itself. It's all about building trust and making sure surgery is a choice you make with your doctor, not one that's just made for you.
And this gets to the heart of it, a philosophy called motion first. Now, I want you to think about that for a second. The goal of a fusion is to restore motion. It sounds like a total contradiction, right? But it's not. By stabilizing that one bad segment that's screaming with pain and irritating your nerves, you free up the rest of your body to finally move comfortably and safely again. A recommendation for surgery should never, ever come out of the blue. It should be the final step in a really careful process.
You're talking about comprehensive imaging to prove there's instability, carefully matching your exact symptoms to that specific problem, trying all the conservative stuff first, and only then having a real open conversation about the risks and benefits. It's a very considered conclusion.
So this brings us to what's probably the most important question of all. What happens after? What does life actually look like once you have that stable foundation? Well, the reality of recovery today is pretty remarkable.
Let's just walk through this. We're talking about patients being up and walking within hours of surgery. Not weeks, hours. Within a few weeks, you're resuming light activity. And by 2 or 3 months, most people are feeling a really meaningful improvement in how they function every day. That old myth of being stuck in bed for months, it's just that, a myth.
And this brings us right back to the patient we met at the very beginning. Remember that feeling of shame she had? Well, look at this incredible shift. She went from shame to understanding that the fusion was the one thing that could give her the support she needed to move again. And the result? 6 months later, she's hiking, after 3 years of not being able to. That is what a return to motion looks like.
So if you take one single thing away from this, let it be this. Fusion is not about giving up. It's not a failure. For the right person, with true instability, it is a strategic and powerful choice that gives your body the foundation it needs to heal, to get strong, and to move forward.
The technology has changed. The philosophy has changed. The outcomes have changed. So maybe the question we should be asking ourselves isn't, how do I avoid a fusion at all costs? But instead, is this fusion the very foundation I need to get my life back?